Welcome to Dental Play. This YouTube channel is dedicated to make small topic videos for quick revision. Today, we will be discussing about atropine. Atropine is an anticholinergic drug. It is naturally obtained. Mechanism of action of atropine. Atropine binds to the muscarinic receptors, which blocks the effects of acetylcholine and other cholinergic receptors. Atropine is a non-selective antagonist, which means it blocks all the subtypes from M1 to M5. Pharmacological action. On the CVS, it increases the heart rate. In large doses can lead to vasodilation and hypotension. It decreases the secretions except for milk. There is reduced in salivary secretion, which can lead to dry mouth. It acts as an anti-celiac. Dry mouth can lead to difficulty in swallowing or dyspepsia. Its action on the smooth muscles. On the GIT, it decreases the tone and motility. It relieves the spasm, which can lead to constipation. On the biliary tract, it relieves and relaxes the biliary spasm. On bronchial smooth muscles, it causes bronchodilation. On the urinary bladder, it relaxes the urinary bladder and leads to urine retention. Actions of eye. It causes mydriasis, which is dilation of the pupil. Ciliary muscles are paralyzed, which can lead to cycloplegia or paralysis of accommodation. There is an increase in intraocular pressure due to the blockage in draining of aqueous humor. The CNS effects. There are mild CNS effects, but in high doses, it stimulates the CNS as it crosses the blood-brain barrier. It causes hallucinations, delirium, restlessness, and disorientation. Coming to the pharmacokinetics, it is well absorbed, it crosses the BBB, and it is metabolized by the liver. The adverse effects. It causes fever, blurry vision, dry skin, dry mouth, dyspepsia, which is difficulty in swallowing, urine retention, and constipation. In high doses, it can cause hallucination, delirium, psychosis, flushing, palpitations, restlessness, convulsions and tremors, and can finally lead to coma. Poisoning of atropine is treated with physostigmine. Coming to the uses, it is used as an antispasmodic drug. Diarrhea and dysentery, it relieves colonic and abdominal pain. Renal and biliary colic can also be relieved. Mydriatics and cycloplegic drug. In the diagnosis and testing of errors of refraction and fundoscopic examinations, in therapeutic uses to provide rest for an iris, and mydriatics to break adhesion between the iris and the lens. Pre-anesthetic medication. If given 30 minutes before surgery, it reduces the salivary as well as the respiratory secretion, which prevents the development of laryngospasm and bradycardia. Glycopyrrolate is the drug of choice. Organophosphate poisoning. Atropine IV 2 mg every 10 minutes till the pupil dilates can correct the effects of the cholinergic overdose. Atropine can be used to counteract the cholinergic effects during an overdose of neostigmine and taubucurinin. In bronchial asthma, as it causes bronchodilation. In peptic ulcers, in drug-induced Parkinsonism, and as urinary disorders such as an overactive bladder or urinary incontinence. They reduce the urgency and frequency of urine, they improve the bladder capacity, and they relieve the bladder and reduce the involuntary voiding of urine.